Artificial Intelligence Dr. www.abcpharma.net/English. User question: what are the physiological reasons for increased or decreased water intake requirements in elderly adults? GPT-4o answer: the physiological reasons for increased or decreased water intake requirements in elderly adults are multifaceted and include changes in body composition, renal function, sensory perception, and overall health status. Here are some key factors. 1. Changes in body composition. 1. Decreased muscle mass. As individuals age, muscle mass tends to decrease and body fat increases. 1. Muscle tissue holds more water compared to fat tissue, leading to a reduction in total body water. 1. This can make elderly adults more prone to dehydration. 2. Reduced total body water. The total body water content decreases with age, meaning that older adults have a smaller reserve of water, making it easier for them to become dehydrated. 2. Renal function decline. 1. Reduced kidney function. Aging is associated with a decline in kidney function, including a decrease in glomerular filtration rate, GFR. 1. This reduces the kidney's ability to concentrate urine and conserve water, increasing the risk of dehydration. 2. Impaired sodium and water balance. Older adults may have impaired mechanisms for sodium and water balance, which can affect fluid homeostasis and increase the need for adequate water intake to maintain balance. 3. Sensory perception changes. 1. Diminished thirst sensation. The sensation of thirst diminishes with age, meaning older adults may not feel thirsty until they are already significantly dehydrated. 1. This blunted thirst response can lead to inadequate fluid intake. 2. Taste and smell alterations. Changes in taste and smell can affect dietary habits, including the intake of fluids, potentially reducing overall water consumption. 4. Health status and medication use. 1. Chronic diseases. Many elderly adults suffer from chronic conditions such as diabetes, hypertension, and cardiovascular diseases, which can affect fluid balance and increase the need for careful hydration management. 2. Medication side effects. Many medications commonly prescribed to older adults, such as diuretics, laxatives, and antihypertensives, can increase the risk of dehydration by promoting fluid loss. 5. Decreased mobility and cognitive function. 1. Reduced mobility. Limited mobility can make it difficult for elderly adults to access fluids, especially if they rely on assistance for daily activities. 2. Cognitive decline. Cognitive impairments, such as those associated with dementia or Alzheimer's disease, can affect an individual's ability to recognize the need for fluids and to remember to drink water regularly. 6. Environmental and social factors. 1. Living environment. Elderly individuals living in care facilities may have better access to regular hydration if the staff is attentive, while those living alone might neglect their hydration needs. 2. Social isolation. Social isolation can contribute to neglecting regular hydration, as there might be fewer reminders and opportunities to drink water. Conclusion. The need for increased or decreased water intake in elderly adults is influenced by a combination of physiological, health, and environmental factors. Recognizing these factors is crucial for ensuring proper hydration and preventing dehydration in this vulnerable population. References. 1. Hooper, L. Bunn, D.K., Downing, A. Jimmo, F.O., Groves, J., Free, C., and Hunter, P.R., 2014. 1. Which frail older people are dehydrated? The UK DRIE study. 1. Journal of Gerontology, Medical Sciences, 69, 11, 1389, 1395. 2. Stuckey, J.D., 2005. 2. High prevalence of plasma hypertonicity among community-dwelling older adults. Results from NHANES 3. 2. Journal of the American Dietetic Association, 105, 8, 1231, 1239. 3. Schreier, R.W., and Chen, Y.Y., 2001. 3. Water, sodium, and potassium balance and the pathogenesis of edema in CHF. 3. Heart failure reviews. 6 1 135,146. 4. Weinberger, B., and Klein, A., 2006. 4. Decreased renal function in elderly patients. 4. Geriatric nephrology. 12 4 341,351. 5. Lindemann, R.D., Tobin, J., and Schock, N.W., 1985. 5. Longitudinal studies on the rate of decline in renal function with age. 5. Journal of the American Geriatric Society. 33 4 278,285. 6. Phillips, P.A., Rolls, B.J., Ledingham, J.G., Morton, J.J., Forsling, M.L., and Crow, M.J., 1984. 6. Reduce thirst after water deprivation in healthy elderly men. 6. New England Journal of Medicine, 311 12 753,759. 7. Schiffman, S.S., 1997. 7. Taste and smell losses in normal aging and disease. 7. JAMA, 278 16 1357 1362. 8. Popkin, B.M., Danke, K.E., and Rosenberg, I.H., 2010. 8. Water, Hydration, and Health. 8. Nutrition Reviews, 68 8 439,458. 9. Armstrong, L.E., 2005. 9. Hydration Assessment Techniques. 9. Nutrition Reviews, 63 6 S40 S54. 10. Rowe, J.W., and Kahn, R.L., 1997. 10. Successful Aging. 10. The Gerontologist, 37 4 433,440. 11. Bennett, J.A., Thomas, V., and Regal, B., 2004. 11. Unrecognized chronic dehydration in older adults, examining prevalence rate and risk factors. 11. Journal of Gerontological Nursing, 30 11 2228. 12. Ferry, M., 2005. 12. Strategies for ensuring good hydration in the elderly. 12. Nutrition Reviews, 63 6 S22 S29. 13. Scissofara, K.L., Cruz, R.L., Mayer, D.R., and D'Agostino, J.V., 2011. 13. Water intake, hydration status, and urinary tract infections in nursing home residents. 13. Journal of Gerontological Nursing, 37 8 32 38.